Hello everybody, I'm here Mrs. Brammu, working at SNS College of Nursing. So today we are going to discuss another yet new topic on the assessment of cardiology for a cardiac patient. So it's the hepatojugular reflex assessment. So from the word itself you would have guessed it, that is we are going to compress at the abdomen and find the filling of the jugular vein. So this is predominantly done to know how far the heart is enabling or entangling the venous return of sudden venous return and how far it is responding. In case of a positive response, the jugular reflex will be high and you can see prominent jugular vein for more than 3 or 5 seconds. So the focus assessment here is that the hepatojugular reflex test is a simple method of physical examination that is going to assess the response of the neck veins to pressure applied over the liver. So this is a very essential tool for diagnosing the right heart failure patients. So the positive result is like the sustained rise in the jugular venous more than 3 centimeters indicates that the patient is having right heart failure. So what is hepatojugular reflex? This is actually checking for a sustained increase in the pressure of the neck veins. It can help to determine if the patient has congestive cardiac failure. It also helps to determine ascites that is caused by the liver. How long do we perform this assessment? So this assessment is to be done in a patient being placed in a full semi-Fowler's position or semi-recumbent position, and pressure is applied directly over the liver, and you can see the observed changes in the neck veins. So how we can interpret the response? As a sustained increase in the pressure of the neck vein indicates that there is high chance for right heart failure. If a normal patient, the right atrium cannot accommodate the pressure that is applied to the liver. The hepatojugular reflex test can be performed at bedside and it is a non-invasive procedure. It can be performed early in the course of congestive heart failure rather than the signs and symptoms. The negative response would be indicated by lack of swelling of the jugular vein. Negative abdominal jugular reflex is seen in Bucharest syndrome. So you cannot take it lightly even if it is false negative. So you have to correlate with the patient condition and find out whether the patient is in negative or positive response. A positive response is variously defined as either a sustained rise in the JVP of at least 3 centimeters or more than that, or might be there must be a sudden fall of 4 centimeters or more than that as soon as the examiner is releasing the pressure. So in such states, we have to escalate to the doctor as early as possible and the necessary interventions can be started to reduce the workload of the heart and to improvise the cardiac output for the patient in case of a congestive cardiac failure. So some of the important considerations is that training is very crucial for all the paramedical workers who are going to do the hepatojugular reflex test, and this is to be done in appropriate patients. In case you find that there is a coronary abdominal aneurysm or there is a tumor in the abdomen or might be there is some changes in the liver or spleen such as hepatomegaly or splenomegaly, this is not to be followed. And I hope you all enjoy the video. So if you have any further doubts relevant to hepatojugular reflex assessment, please don't forget to give your suggestions on the comment box, and don't forget to like and subscribe as well as follow my channel on regular basis. And that's all for today's session. Thank you all. Have a nice day.